Yeah.
All right, we're good to go. Yes, it is.
Stop by and sometimes.
Good morning, everybody.
Good morning.
Okay, we're about to start. So, like they do on TV, we're live from the Parks and Recreation Center on Russo Boulevard, not too far from Port St. Lucie Boulevard. So, great spot, great location. We have these every month from January all the way through October, November, December. We have a couple other things going on. We're fist fighting with the turkey when we have the holidays. So, anyway, we are live. We've had the system all set up. A lot of work. And at that point, so you're live right now on YouTube. We have our own YouTube channel for the Treasure Coast Advocate for Seniors. So our speaker and our coffee sponsor, all that, will get a chance to talk today and tell you everything that they have and what they're doing. And so Mary, the other day, she tried something about a month ago and said, well, you know, anybody like free? Okay, free's pretty good, right? Especially if it's a good thing. So she started putting free on next door. So this event free. So she did it at the beginning of the week. For this, she had about 800 views in just a couple days. That's pretty neat. So if you have things that you do for free, you might want to think about it. But what I'm really trying to say is please do that for Treasure Coast Advocate for Seniors. I personally do a lot of the marketing and I get 15 different venues multiple times a week just for Treasure Coast. So that's about 45 posted advertisements a week I do. So, and I do that, and it doesn't take long. You get used to it to do that. So please share.
Can you share those venues with us so we know?
Oh, YouTube, Nextdoor, Facebook, X, which used to be Twitter. The other one they're trying to get rid of, the state,
TikTok.
I'm sorry, TikTok. TikTok's big. A lot of those sites you can add music to for free too, right? And you get the people to pick the music. I mean, the list goes on. And then one of the biggies that most people don't even know about is the Facebook share groups. And I go and look at those groups, they might have 5,000 to 10,000 people. And I share it, and it's like this, click, share, boom, done. Just like that. That all takes time. So a lot of great information. What we're going to do is start off and go around the room and introduce yourself, right? Let's start over here.
Hi there, good morning. Catherine Griffin, Pinnacle Home Care and Vice President of Treasure Coast Advocates for Seniors. Welcome, everybody.
Hi, Mary Scott. I'm with Keller Williams in Port St. Lucie and also a board member.
Hi, I'm Dr. Miriam Pinchon-Vassal with Chairman of Medical and Wellness Center, and I will be presenting today.
I'm Linda Gordon with Linda Gordon Medicare Solutions, and what I do is help people from beginning to end with their Medicare situation, helping them decide on the plans they want, and helping them throughout. I'm an advocate, senior advocate also.
My name is Jennifer. I'm the Resident Wellness Director with Watercrest Senior Living. My name is Shannon Rochester, and I am the Business Office Manager at Watercrest Senior Living.
My name is Maureen and I am the Memory Care Director at Watercrest Senior Living. We have Watercrest in the building.
I'm Pat Miles. I'm the Sales Director for Harbor Place.
morning. I am Karen Hodges. I am a daily money manager with Freedom Support Solutions.
Good morning, Dana Foreman, notarized with care and fingerprinting with care, all your ACA background checks.
We remodeled Molly's house. And thank you, Aqua Services, for the beautiful spread.
Christine Rigg, Elder Home Care Services, Private Duty and Placement.
Anna Morton.
Oh, board member.
Francis Burgos with Preferred Home Care Services. I'm the area manager and also the clinician. We do all of physical therapy, occupational speech, you name it, IV, anything you can think of, we do it. And if I don't do it, I'll tell you who does.
Good morning, everyone. I'm Andrea Davis, Superintendent of Touch Caregivers, our Patient's Choice Home Health, also board member.
Good morning, Matt Baxter with Stay Safe Services. My focus is helping seniors keep their independence by doing home safety assessments. I do sell some equipment, but my focus is the home safety assessments.
Mike with Aqua Home Care, Private Duty.
Step on over.
Sorry.
Come on over and talk.
Benjamin, Aqua Home Care. So board member as well, and today a cameraman. So I apologize.
And sponsored this great breakfast, right?
Yeah, I'm gonna let Mike take that one, actually.
Okay, all right.
It's a little more.
Okay, you want to come out and talk a little bit? Just a little bit out this?
Good morning, my name is Alex Foreman with Techie Expert Web Design and more. Not only am I volunteering my time with this amazing organization to help live stream this to you out on the internet, but also to provide these services to the community. I provide not only web design, graphic design, email and backend automation, Google business profiles, ad consults, pretty much any of your tech needs to help increase your brand awareness and get more customers driven to you online, as well as automating your workflow so you can spend more time doing what you do best, interacting with your customers. Thank you.
Thank you. And again, Tom Scott. I just want to again thank Alex and everybody that participates in our group, all the effort. And, we get a lot of people, we got people coming on now that are watching this stuff live that don't seem to want to get out of bed at 5 or 6 in the morning like we do, right? So it's great that this is on YouTube. They can go see it. You can talk to people, you can pick it up, you can share it with people that need, and we're going to have a fantastic presentation, which that alone should be something that you want to share. And of course, I'll give you a little hint, want to remember to share it. I'm just giving you a little bit of it. Okay, so let's talk about the coffee sponsor today, right?
Mike, you got this?
Sure.
Mike, you got it?
Sure.
All right,
Come
Mike,
on up, Mike.
come on up.
Really?
Yes.
Pretty simple. We provide caregivers in the home. We do have 2,000 caregivers throughout the state. I like to always start at continuity of care as number one. So that's important with dementia. So a lot of times we'll have one caregiver if possible. We do live-in caregivers, so it is very possible to have one caregiver. The nights are quiet. We do a live-in. A lot of times it's about half price of normal rates. That's about it. And so I'm the area manager. I cover from Brevard down to Seward.
Okay, thank you very much. So I'm going to introduce somebody that's going to talk a little bit about history, and she'll eventually introduce their speaker and everything. But just like a house, we're in Florida, our houses are built on sand. So without a good foundation, right, because we don't have a basement and all that kind of stuff, without a good foundation, a house, can wind up having problems. And we have a lot of people that are involved in this group. And hopefully there'll be more of you out there that want to get involved. And you can do that by going to the Treasure Coast Advocate Seniors website. You can join, you can donate, you can do all that. We're high tech, we have all that stuff. You can go right on, get your credit card out and put some money in it. But she's gonna, she's been a pivotal foundation for this group for what, 15 years?
Since 2008.
Okay, a long time. So that's 16 years, right? 16 years.
I'm terrible at math, so.
16 years.
Whatever you think.
16 years. So without her, you know, we wouldn't have that foundation. Again, there's a lot of people that surround her, that surround us in order to put this together. Not any further ado. Back to Griffin.
Very nice. Thank you very much. And it takes a team, so it's a team effort. We have a great board. I'm going to read the mission statement before I introduce Dr. Vassar. The mission of Treasure Coast Advocates for Seniors is to provide healthcare and financial education, counseling, and assistance on the Treasure Coast. TCAS, as we call it, was started back in 2008 when Mona Gwynn Huff, Kim Nelson, Gil White, Pam Springer, Kathy Blackman, and myself decided over coffee to help seniors on the Treasure Coast. Nancy Hannon, Leslie Lee Borellis, others joined the board shortly after that. Since then, Mona and Will have passed. We honor them with carrying this torch and of assisting our seniors. We are all volunteers. Each of us have regular jobs, but our commitment is to help seniors in need. In the past, we've helped seniors with their air conditioning issues, carpet cleaning, pest control, and even pet supplies. Recently, we bought a refrigerator for a senior. We bought a washer for a senior. So we help people in the community that are really in dire need. If you have a senior that needs help, please speak to one of the board members and we can assist. Our meetings are held here every last Thursday of the month, except for November and December. We're always looking for new members, and you can join on our website, tcadvocates.org. It's been an honor and a privilege to be your now vice president and founder of TCAS. So before I read Dr. Vassar's qualifications, and boy, after reading this, I was like, what? Oh my gosh, you're a busy lady. So we've got Dr. Vassar today that's going to speak about managing dementia. We've got in July, Michelle Franklin, our St. Lucie property appraiser, and our coffee sponsor is Aviva. In August, we have DCF coming. She's going to be talking about abuse, neglect, and exploitation in a vulnerable adult. And our coffee sponsor is Senior Helpers. In September, we have Dr. Rains. He's with Florida Orthopedic Specialists, and he's going to be talking about bone sparing techniques. Molly's House is going to be our coffee sponsor, and Christine's helping with that. In October, we've got Matt working on a speaker, and no meeting in November or December. In December, we will have a holiday party out here. So, in January, Dr. Tradewell, we've got a doctor coming in and speaking about urology issues. So if you know somebody who wants to speak for after January of next year, let me know. So Dr. Marian Vassar, a nurse practitioner with more than 20 years of nursing experiences, providing care to adult and geriatric patients since 2002. As of 2012, she has worked as a nurse practitioner in internal medicine, primary care, subacute and long-term care, and assisted living facilities. She has completed her thesis on managing dementia with behavioral disturbances. She's been a teacher, preceptor, and mentor to nurses and nurse practitioners alike. Her goal is to provide the highest individualized care, standard of care with compassion and dignity. Her degrees and certificates: Doctor of Nursing Practice with honors from UCF, Master of Science in Nursing Practice, FAU, magna cum laude, and Dean's List, Bachelor of Science in Nursing, Board Certified Adult Nurse Practitioner, DOT Certified Medical Examiner, Wound Care Certified, member of Sigma Theta Tau, is that how you say it? And Florida Nurse Practitioner Network, and Society for Post-Acute and Long-Term Care Medicine. And I should tell you, if you have the opportunity, her office is absolutely beautiful. So isn't it so pretty? So let's give Dr. Vassar a great big welcome.
Thank you, everyone. All right. And so I'm just going to share the PowerPoint presentation. There we go. Okay.
All right, as I said, my name is Miriam Pensionat-Vassor. I have a doctorate in nursing practice and many other certificates. I have a practice down the street, 5 minutes from here. And today I will be presenting dementia, the management of dementia with behavioral disturbances. Okay. So what is dementia? Dementia is a loss of cognitive functioning, thinking, remembering, and reasoning, according to the NIH. Okay, dementia is the most common form of Alzheimer's disease. And approximately 5 million older adults, 65 and older, have dementia in the United States. And this number is projected to triple by 2060. It is also the leading cause of disabilities in the US and the sixth leading cause of death in the United States. So having dementia and having behaviors, they call it behavioral disturbances or BPSD, we'll see me referred to, make things worse. Okay. The projected annual cost of care is expected to rise from $215 billion to $500 billion by 2040. So in 15 years. So this will be the cost, and probably even higher with everything going up so fast. Okay. So what is behavioral disturbances or dementia with behaviors? Okay. A lot of healthcare providers, even nurses, a physician, they are not attuned to behavioral disturbances. People who does MDS knows that when you have anxiety, depression, and have dementia, you fall into that category. What is it? BPSD stands for behavioral and psychological symptom of dementia. It is an umbrella term that describes a group of symptoms of disturbed thoughts, perception, and mood. BPSD can lead to terminal health complication. It accelerates the deterioration of dementia. And it is a great source of distress for the patient, the family, the caregivers. Okay. It impacts the patient's quality of life and functional abilities. And as we said, having BPSD escalates the cost of care. So long-term care facility, you find a lot of patients, 80% of dementia patients in the long-term care facility have BPSD, and they have 2 or more symptoms. What happened as a result of that? They have higher incidence of falls, higher frequency of emergency room visit, readmission rate increase, higher risk of health complications such as weight loss, nutritional and fluid imbalances and infections, and higher rate of psychotropic prescription drugs. Okay. So in the long-term care facilities, there are certain factors that exacerbate BPSD. What are they? Nursing shortages, limited resources, knowledge deficit is a big one, okay? And there's very little protocol to assist clients, whether in the community or in the long-term care setting, to manage BPSD. BPSD encompasses a broad range of symptoms, from labile mood to unacceptance of ADL to physical aggression. These are some of the most common behaviors presentation of BPSD: agitation, aggression, anxiety, depression, apathy, sundowning, delusion, hallucination, wandering, and sleep disturbances. So we do have a handout of those most common behaviors and what to do to manage them, okay? The non-pharmacological management. That's what we're presenting today. Dementia patient can present with 1 or more symptoms of BPSD, and they can have different manifestations. What does that mean? You can have somebody who have dementia with anxiety disorders or with depression, and they react completely different. And the treatment that you provide to one person is not the same for the other. So that makes it very difficult to manage. So over the last few decades, CMS has done a lot of work, a lot of money, to reduce the use of antipsychotic in the nursing home and in the community. And they have had some success. Now they have expanded the mission to reduce the use of psychotropic medication. What are psychotropic medication? Psychotropic medication are your anti-anxiety, your antidepressant, your hypnotic, the medication that puts you to sleep. These are your psychotropic medication. So the goal is to reduce those in dementia patients. So what's left? The non-pharmacological intervention, the non-drug measures that no one wants to do. Okay, let's move forward. So despite all those initiatives and the success that the CMS has had with the antipsychotic, drug therapy remains very prevalent in the community and in the long-term care settings. Using the drug therapy, antipsychotic, there is no benefits. They outweigh the risk. There is no benefit. They increase the probabilities of adverse events, hospitalization, strokes, and death. So you imagine you're trying to care for a person, you're giving them things that can give them a stroke. Currently, there are no antipsychotic medication approved by the FDA for the management of BPSD. There is none, okay? And they have been proven to be inefficient with significant adverse effect. So what are non-pharmacological intervention? It's a long word, non-pharmacological management of BPSD. It is also known as the non-drug approach. It is described as a psychosocial approach to address modifiable psychobehavioral factors, psychobehavioral symptom of dementia through the elimination of physical, social, and environmental factors with safe, low risk or complementary method. So that's a lot. So it is a psychosocial approach. It's get to know the clients, get to know the individual, the resident, the patient, get to know them, and for you to create a plan of care that will suit them. That is what that is. Okay? Non-pharmacological intervention are the recommended first-line treatment for BPSD, and it must be continued even when the need for medication are necessary. Sometimes medications you can't get away without it. Okay, so if you have a very aggressive person who's putting him or somebody else at risk, you have to use medication, but you never use the non-pharmacological measures. You still have to do them as a complementary method. Okay. So how do we do non-pharmacological intervention? How do we do it? So I have researched, I did my thesis on that, a broad range of literatures. The most effective way for you to approach it, you can approach it for someone with dementia, your parents, as a caregiver, as a nursing home administrator, a DON, you can use this. How do you approach it? You use DICE. DICE is one of the most effective ways as a guide to teach you on how to do it. DICE is an acronym to assist you to implement non-pharmacological measures for the management of targeted disturbing behaviors. D is for describe, and I is for investigate, C is to create, and E is to evaluate. D, it aids you in specifying and articulating the behavioral problem by asking these 4 W questions: who, what, when, and where. What is the nature? Think about it. What is the nature of the problem? This offers you an opportunity to know about that particular behavior. When is the problem occurring? Is it at nighttime? Is it during the daytime? Is it after an activity? So you want to know, when is it happening? Who is involved? Is it someone the person has a delusion against? Who is the behavior is target to? Is it, I don't like my neighbor? It's the focus is on the neighbor. So you want to know who is involved. That's the who question. And where does the behavior usually take place? Is it in the room? Is it at night? Is the light? What's going on? So you assess the environment, knowing the person. So that helps you to do that. Investigate. Right? What happened right before and after the behavior occurs? Keep in mind, one behavior may have numerous causes and triggers. What are the potential causes of that particular behaviors? If someone is very aggressive, what can happen? Can they injure someone? Can they injure themselves? Are there any, and you always have to see, are you doing anything that could causing that behavior? Are there any medical? Am I giving you some medication? You having side effects of that medication that exacerbating that behavior? So assessing that, evaluating that will help you to create the plan. To create is to take action, to implement a non-pharmacological intervention for that target behavior. The first step is to choose realistic and achievable non-drug measures with a focus on the dementia person as an individual. And aim to maintain their resident dignity and improve his or quality of life. So never forget that. Maintaining the person dignity and quality of life should always be at the forefront of your intervention. Okay? And choose that person as an individual. What works for somebody with mild dementia versus someone with severe dementia? You cannot choose the same intervention because they're not there. So that's why you have to get to know that person. Okay. Remember, the most important thing, remember to reward the person, reward the dementia person, and reward yourself. If you're the caregiver, reward yourself. If you are the person in charge who send that person to work and they're doing a great job managing that behavior, preventing that person from falling, preventing things from happening, reward them. So that encourages them to keep doing it. Okay? So that's important. And always evaluate. The evaluation process is to help to appraise the intervention and modify it as necessary. Remember, dementia is progressive, and so it moves. It doesn't stay. It's not static. It's always getting worse. So one intervention that worked this year may not work next year or a month later. So you have to reevaluate. During this process, it is crucial to assess the feasibility, the effectiveness of the applied measures. For ineffective measures, one must re-examine the comorbid acute illness and see, okay, what can make, if I was doing music therapy for someone, now the person went to the hospital, they're in pain. You have to reevaluate that. So you need to do something for the pain. Maybe heat therapy, maybe cold therapy to manage the pain, because the music therapy will not be as effective as it was before. So that's why it's important. Make the necessary revision. Flexibility and creativity. Always stay creative when you are dealing with dementia resident. Okay. So these are the most common dementia symptom: agitation. We all know someone have experienced someone with agitation and aggression that has dementia. Okay. So what is agitation? It says it's here. It's characterized as an inappropriate verbal, vocal, or motor activities that range from verbal utterances, screaming, yelling, abusive language, and even physical threat. What do you use for agitation? This is an example. So for those of you who are interested and applying this to your resident, to your family member, to your caregiver, what do you do for someone who is agitated? What is a non-drug measure? You can use therapeutic communication. Talk to the person at the level, okay? Provide positive reinforcement, use distraction, stress reduction technique, create an environment where you reduce the stressful stimuli. Eliminate sources of conflict. If someone is agitated, don't confront them. Don't prove them that they are wrong. It's not the time. They're gonna get more agitated. The most effective measures to manage agitation is music therapy, physical activity, multisensory therapy. And there are many technology, and I've heard a few presentations in the market that can help. There's now robotic touch that you can put in the home. You have Alexa that you can program to play music for the person. Know the genre. So know the favorite music. Talk to the family member. Oh, what did they like to listen to? And play it and see. I have had patients where they completely agitated, and then you will put rock music for them, and they are like have stage dementia. They not talkative, okay? They agitate, they trashy. And then you put the music right away, they stop. And it's a whole different thing because it's resonant. Music resonate even when you have no language left, you have nothing left, but they understand music. So I have seen it. So it works. Apathy. Apathy is a loss of motivation. These are those patients where you see them, they just sit and the face is completely, there's no expression. They are not motivated to do anything. This is apathy. What do you do in that case? You have to be supportive. Limit goal, give them only small tasks, only small little things, meet them where they are. Encourage activity within the person's ability and willingness. Agreed compromise. Reward cooperation. They don't want to do anything. I'm not going to go take a bath. When they do it, reward them, okay? And multisensory stimulation, again, tactile, aromatherapy, all those things help. So moving along, anxiety, it tells you what to do for anxiety. We all know what is anxiety. And keep the environment calm, comfortable, maintain familiarity, stimulating present, therapeutic touch, reassurance. Once again, music therapy and multisensory therapy, which is aromatherapy, touch, all this thing are multisensory stimulation. Depression. Someone with depression and have dementia, increase social interaction, recreational activities, encourage enjoyable activities. What did the person enjoy to do? It's like playing bingo, art and craft, whatever it is, to that particular person. Treat every person as an individual. It's not a one shoe fit all. Taking the person outside for sunlight. Sunlight therapy works very well. Fresh air. Individualized music, the person's preference, what do they enjoy? Giving them activities to do, like if they are in a facility, give them papers to file, put them Incorporate them in your workspace. Give them purpose. Okay, so that will help. Redirect and refocus. Reminiscence therapy is very important. That helps them. Memory book, pictures, happier time. Music therapy once again. All right. So delusion. So these are the hard one. Delusions, an expression of fixed false belief, which can be paranoid and accusatory in nature. So what do you do for somebody who's delusional? Provide reassurance, use distraction, avoid interaction that may be misinterpreted, remove object of focus if possible. Validation therapy, acknowledge and accept the patient's reality, the person's reality. Once again, accept their reality. It's not the time for you to correct them, okay? Distract them, okay? Okay, I understand. You believe this is what you see. This person is coming, the cops are coming, the government is after you. I understand that. Let's try to do that now. We'll talk about the government. Tell me more. You validate them. It's very important. Hallucination. Hallucination is the most common form. They are visual and auditory, which the person hears or sees non-present entities. Provide reassurance, use distraction technique, exercise benign neglect. What does that mean? Do not interfere or attempt to prove that the person is wrong. If the person I'm seeing the police standing there or whatever they're seeing, there's a man with a gun after me. Do not say there's no man with no gun. It's just like, okay, you are seeing a man with a gun. You acknowledge the person. Let's go over here then. I'll send someone to talk. We'll deal with it. Okay, so you acknowledge the person instead of being confrontational. If you say, well, there's no man with the gun, then it goes, I'm telling you, I see it because they are seeing it. Okay. Resistant to care. This is something especially for people in facility. They have opposition to the caregiver's effort doing activities such as feeding, bathing, toileting, and other activity of daily living. For these people who are resistant to care, limit goal, be gentle, agree to compromise. If you do this for me, we'll do this later. Okay, agree to compromise. Reward cooperation. Provide, if the person is too busy, provide them with finger food. If they haven't taken a shower, they don't want to take a shower, don't throw them in the shower. Says, okay, let's go get a bath instead. We'll do a good bath. Maybe tomorrow we'll do the shower. Remember, you promised tomorrow we'll do the shower. Okay, so compromise with them. Music therapy, calming is also very effective. Relaxation and reminiscence therapy are effective to manage resistance to care. Sleep disturbances can be characterized as a lack of sleep or excessive daytime sleepiness in patients with dementia. Okay, so it's either they're not sleeping or they're during the day simply sleeping during the day and they're not doing anything. Increase the time activity. Sunlight exposure is bring them outside for a few minutes. Wheel them in the wheelchair if they can't walk. Limit daytime nap. Wake them up. Okay, your hour of sleep, let's go outside and take a little bit sun. Establish a routine. Optimize the sleep environment, adjust noise, light, and temperature. Reduce evening caffeine and fluid consumption if they are waking up at night because they have to go and pee. So get to know the person with dementia. Relaxation therapy and bright light therapy are very effective to manage sleep disturbances in dementia. Sundowning. Escalation of behavioral symptoms such as agitation in the afternoon or the evening hour. The goal is to prevent the behavior from escalating, reduce potential stressors. Once again, get to know the resident. Go back to DICE. What are the potential stressors? What are the triggers? So if you know the triggers, you can reduce them. Bright light therapy is effective. Okay. Wandering, the last one on the list. It's visible, non-goal directed ambulation. So they have no purpose. They're just wandering around, or other form of locomotion. It is the most challenging behavior to manage and has incongruent definition and unknown etiology for wandering. Environmental modification, safety measures. So it's very important you keep the patient safe because they wander. They can wander into the pond. Encourage exercises activity. If they are a wanderer, put them on exercise class. Get them activities that tires them during the day so they don't go wanders at night. Dancing. Visual cues. Post sign. This is your room. Don't enter here. Post sign so they know. Put the pictures on the door, like based on the stages of dementia of where they are. Some of them you can write. Do not enter, your room is here. Sometimes it's the picture that you have to put. Or a big red stop sign, do not enter here. Okay, so you can make sure safety first. When you're dealing with dementia, safety. Okay, safety is always first. And so we do have a few of those for people who are interested into implementing them. And that is the end of the presentation. I try to keep it short. Thank you.
Does anybody have any questions?
Questions, Q&A?
Well, I was thinking, all those different interventions, it's like a 24/7 job for somebody in a nursing home or wherever. How do they get somebody to be on top of the person all that time to do that?
So if you triage your patient, like getting to know in a nursing home facility, you get to know your resident, okay? You can categorize them. Group therapy, there's activities, okay? Physical therapy, there's someone who's a wanderer. Have them assign physical therapy. Have the physical therapy assist with that, not just the nursing staff, not just the activity. If the person, music therapy, that you can do group therapy, or some people are just in the room. You can play music, you can have the family buy you a little Alexa. You can have a pre-recording messages. Sometimes they want to hear the children's voice. And the child will say, Mom, sit down. Mom, you are safe, don't do that. And you play it for them. So it is not as hard as it appeared. It's just, you just have to get to know the resident and implement it. Well, if you make it a goal to prevent them from using medication that can harm them, you will make it happen. Assign different staff. There's almost every nursing home has an activity director. There's certain things that they can do. Put them in the garden. Have them sit by the porch with someone, for a few minutes during the day. Yes, it is not easy, but it is.
Yeah, it's like a
doable.
Very labor intensive. I have another question. So you mentioned that you're getting away from the antipsychotic drugs.
Yes.
What are some of those drugs?
The antipsychotic drug are like you have your atypical and your typical antipsychotic. You have Seroquel, Haldol, Zyprexa. These are your antipsychotic. And your psychotropic drugs are medication like the SSRI, the SNRI, the anxiolytics. They are the psychotropic drugs. So we're trying now to not prescribe the Xanax, the Ativan to the patients.
Where would lithium be in that? Is that part?
Lithium is a mood stabilizer.
Would that be stopped?
Lithium is not is not prescribed to dementia patient unless you have you can have dementia and have a psychiatrist.
Right.
Exactly. If you have bipolar depression. That doesn't mean the bipolar depression is cured. You still have dementia and bipolar depression. That's where your lithium play a role. But if you just have dementia with agitation with no prior diagnosis of bipolar depression, for example, lithium does not play a role. It would be a no-no because lithium will kill that person within a few months.
Lithium would kill them?
Correct.
Really?
Because the side effect of lithium affect your sodium. They go into SIADH.
But then,
They have sodium overload, they go into hyponatremia, a lot of complications. This is why they say they are not safe. Remember, as you get older, you not absorb medication. If you are not remember, if you are in the 30s.
Okay, because I know somebody who's bipolar and is taking lithium. So is that gonna cause an early death?
If you're taking lithium, lithium has its side effect, but as you age, the side effect of medications changes. It's worse. You are more prone to them. So if you read lithium, you will see all the side effects. And even that person at a young age, if they're not careful, they're not doing certain things, they're not measuring their level, they're not doing certain things. Yes, it will kill you.
Thank you.
Okay.
Question, first of all, awesome. I really appreciate what you're saying. So a lot of what we do is putting caregivers in the home, and so the question is, how do I distill this message down to like one sentence that I can give to a caregiver so that they walk into the home better armed with this?
So what I will say is for your caregiver to be attuned to that particular person they're caring for. Be attuned to them, get to know them. When you do your admission, it's very important. Doing the admission process is the time you incorporate some questions into your admission packet. What are the preferences? They have dementia. What are the preferences? What are their favorite food? Are they somebody who usually cold? So you can have a normal temperature of 76 in a home. It's way too cold for that person. So you ask the family member or someone who knows that person, okay, what do they like? What type of music they like? So once you know what they like, then you will implement certain things for them. And then that's why when you use the dice icon in, you will do the investigation. You will, okay, I come in, doing the admission, I see they don't like this person with red. Red is a color that throws them off. Every time I wear red, he or she is agitated. Don't wear red. Red is a trigger. If you do this and it works, and write it down, pass it on. When I do this to the next caregiver that's coming in the home, I did that for, she was so agitated. I did this and it works. I bring her outside for 15 minutes in the sun. Then we eat some popsicle, some fruits and things like that, and water, and we sing music. And we do clapping, that makes her happy. So the next caregiver do the same thing, you continue the continuity of care. And you just pass it on. But it's to get to know that particular resident. But ask a few questions, incorporate a few questions into your admission package. This is the time where you communicate with the family, know those person preferences, especially the type of music, the type of food. I've gone to people home who's not eating, not drinking. They don't think, oh, older adult, they have early satiety. Okay, I'm gonna give you breakfast, lunch, and dinner. Okay, that's absolutely. The caregiver comes, okay, lunch, breakfast, lunch, and dinner, here's your lunch, and serve it to the patient, eat nothing. Dinner, eats nothing. What's going on? They're not eating. You know why they're not eating? The moment they see that big plate of food, they have no interest. They have early satiety. So it is best to offer frequent small meal, finger food. Here's 2 French fries. Here's a fruit. Here's a popsicle. Every couple of hours, oh, why don't we take this? Let's do this. Okay, you just come out of the shower. Okay, let's sit here. Here's that. Instead of, here's the pizza, here's the lunch, here's the dinner. Because we put them and then they deteriorating and you're not even seeing it. because you think you're doing, you're helping, but why you're not? Really helping because you're not acknowledging, or maybe sometimes it's a lack of knowledge deficit that causes it, even with best intention.
Excellent presentation. Thank you so much, taking time out of your day to do this. My question is sundowning. Is there a specific drug or drugs that doctors prescribe for that?
Sundowning just is the hour when it's occurred. So preparing for sundowning, there's not a specific drug. We're trying to stay away from drug therapy unless it's absolutely necessary, but you can prepare for sundowning.
And how?
So if you know, by 5 o'clock, the resident gonna go, they're gonna get agitated. It's okay. 4 o'clock, I'm gonna give you a shower. 5 o'clock, they're gonna go, wow. 4 o'clock, by 4 o'clock, I'm gonna give you a bath, make you cool. I'm gonna play some music. We're gonna sit down, or I'm gonna put you somewhere, something that they enjoy to do, so you can reduce the effect of sundowning. Okay, at a certain point, and if you know they're on certain medication, like for example, Exelon is one of the drugs that really help. It's for dementia, it's help with your memory, but it's also help with behaviors. So you schedule that medication an hour before they start reacting. Okay, and then you also do the non-pharmacological drug measures. Drug alone cannot do it. So you still have to know about that. Because that's what makes you treating the person as a human being. It makes it human.
Sometimes right now we need to educate family members.
Yes.
Because most of the time they do not understand how to take care of their mom, dad, and then it create a big problem for the caregiver that inside, because they wanted to do, I want my mom to go to the dining room to have breakfast soup. Even when you tell them she can't do it that way, to give finger food, take her outside so she can enjoy the sun, as you said, and give her something to eat while she's sitting there.
So that's why when you have care planning, you discuss that this is what we've done and this is what have worked for your mom, and your mom is a much happier person. At the end, all family members want to see their loved one do it. They want to see the progress. So when you care planning, this is what we've done, it's worked for her, and this is what the research has shown that works, and we're doing it, it's working for them, and they will come on board. But if you tell them nothing, they think, oh, you're just neglecting her, you're just keeping her in the room, or you just don't want her to socialize, you're isolating her. This is what the first thing that comes to mind. You isolating her because she's not uniform to the rest. So they get.
There's a program for that. There's a program.
Because I have a family member that really needs to get more information.
It's a free program. It's called, if they have caregiver syndrome, then you can follow Roselle. It's provided by a grant.
Educating them, educating the caregivers. All right. Any other questions?
Thank you.
Great
Really.
Thank you so much. Thank you.
Thank you.
Pleasure.
Thank you.
No.
This is great, but.
When you think that you know a lot about certain items, that's why we love these meetings so much. Look at the information we got today. We got a lot of astute professionals in this room right now. I'm sure you've got a lot of. Don't forget, it's recorded. The people were tied up, there are other meetings or whatever the situation is, they can go on to our YouTube channel and they can get this. It'll be on within minutes, correct?
Correct.
Doug?
How do you search for different topics on YouTube? Like for this one or for another one?
What you do, it'll say what it is and it'll give you the date. And of course, we're gonna show you, I want to go up to back to my site so I can bring up our Facebook site, and that'll tell you a lot about it. So,
I'm gonna go ahead and end it. You want to close out? Have a little,
no.
you want to go right to the website.
No, I want to go to Facebook.
Oh, the Facebook, okay, sure.
Right. here.
So,
There we go. Okay, so I want to be able to get it up there.
from there.
Okay, so it's asking me to log in now.
Right.
You can't see a login.
Maybe want me to pull it up in the other tab?
Yeah,
Yeah.
that's easy. That's the way I always do it.
Yeah, you
It's a matter of a
should
second.
have-
I got it.
Do you know
I
which,
got it, yeah.
you know which profile it is? Okay. All right, it's actually up on that screen. If you just move the mouse to the right, keep going past the edge of the screen, and it'll be up there.
Can't see to get it. Or, you know, I can't see to get it.
Let's see if I can see it. That's actually your page, but
I go up there to that, right there where our picture is.
oh, you've got it.
Okay, and then it's gonna show the other ones right there. There,
Yeah, I'm just waiting for it to register.
okay,
There we go.
right there.
Okay.
Okay, so this is our Facebook site. So we're still live and so everybody else can see it. So in this, and we put tremendous amounts of information on there. I want to get over here.
Is there a
So,
link on there to YouTube?
well, we have a link on our website, but you'll see why I will post this video to this today, right? So anyway, as you come in here, it'll recognize doctor, right? That's on there. Of course, we'll have something out there thanking her and so on and so forth. And then you can just go right down so you can see all the stuff that we have. And also, and I won't go there, but you go to Treasure Coast Advocate for Seniors, right? And you can go there and you get all this information, including the donations and whatever, okay? So, you know, if you want to donate and whatever, so I just want to implore everybody and out there to the world. And Catherine and I, and our group, we go out and we give, you know, donations to situations. At end of the year, we do it, individually, we do it, and it's just absolutely with the situation that's out there today with, you know, the economy and food is so expensive, you know, and the list goes on, everything, medication or whatever. And, you know, when you go in and you try to help somebody and they don't have a washing machine and there's clothes everywhere, or they use in two different types of refrigerators, freezer, and they're going on and off, they're losing their food and they don't have a lot of money for it. Or you go to the refrigerator and they don't have any pets, but there's cat food in the refrigerator. Okay, so it's important that if you've got a couple extra pennies, not dollars, but pennies, you know, go to our site, Treasure Coast Advocate for Seniors, have the ability to donate or join us. You know, we need all the help. Our seniors need all the help they can. So we're off to events, and our first event, which is our biggest event of the year. We're gonna bring Andrea, which is also a board member, up to talk about it. And here it is, right here. Look here, right? Right there, so you can see that her event is there, and she's gonna talk about what's going on with that. Can we make that bigger?
We have these up front too, in case you want to take something with.
Okay.
So good morning, everyone, and I see a lot of new
To her.
faces. And thank you for coming. And Andrea Davis with, board member of Treasure Coast Advocate for Seniors, and I really love what I do with them. So we are, having an event, and that event is to create funds so we can able to help the seniors out there. And right now, we're depending on you and others outside in the community to help us take care of the seniors in the community. And we have sponsorship still available. We have, a table with eight, guests is for $600. We need baskets, we need, food sponsorship, we need different kind of sponsorship. So everyone is welcome to donate what you have. If you can donate a basket, if you have items that we can create our own basket together. So we can have the auction and whatever auction there, silent auction.
Silent auction, Chinese auction, 50/50, any other auction you can think of, anything that will make money.
Right, so we give gift card, we wanna have a tree that we can raffle. So whatever you can, please help us to help the seniors in the community. This event is the Roaring 20 Extravaganza. It's September 22nd at Treasure Coast Lexus. If you can, please buy your ticket, $75. That
And just a
helps.
reminder, we're all volunteers,
So
nobody
we
gets
have
paid.
volunteers
100%
and everybody
goes
who
to
volunteer, every penny goes back into the organization. We don't take any money.
So
September 22nd.
21.
Yes.
21st.
21st.
You be there the 22nd, I'll be.
I try to close Lexus, so please, we're looking volunteers too, so we have tickets, can purchase.
Oh, yeah, if
tickets.
anyone wants to volunteer that night too, we're looking for more volunteers.
Last year,
It's a lot of work to decorate.
last year, it was a fantastic event.
What?
We had like we were surprised we had special dancers there.
Okay.
Yeah, I'm looking
You
for
don't
that
go
this year. So,
You know, and
So it's
it was
fine.
an absolute blast. I mean, the food was great, the music was great, the venue was great. Being at that dealership is very fancy, right? And you know, anybody know what Whipham is, right? Whipham, what's in it for me? Well, so anyway, we're posting all this stuff. And I meditate Lexus, Treasure Coast Lexus, every time I do it. So over about 6 months, how many is it meditate? Their dealership. So if you are giving, funds, or you're giving your location, or you want to help put on something like this, right? You're getting massive exposure, right? On top of it, we know how the web works. So I'm getting all their lease deals and stuff on all my sites all the time. And then I'm sharing that for them. It's unbelievable. And Andrea last year and this year has just put on a tremendous amount of work to pull this off. And she's looking for more help. She always likes money. Money's a big deal.
That's what make it works.
And you can go onto our
And that's the
Facebook
main
site, and you'll be able to see the sponsor stuff. I'll put that on there again today for the sponsorships and to buy tickets, and you can go online to get the tickets, correct? So we have that link to go on.
Eventbrite, that QR code, you scan it to take you right to Eventbrite. And whoever sponsor, you get exposure to of your business.
Huge.
Huge.
All right.
Aqua does not want to take any food with him. He said, please take some with you.
Yes, seriously, please save my husband from having to explain to my wife why she's got 30 bagels.
Share some of the cards for the big event.
So we want to take some cards to with you and.
Delete a volunteer and.
Thank you. Okay, everybody. Thank you very much. Have a great day.
Bye, thank you.
All right.
Okay.